you all so much for joining us. Um, Tonight, we're going to be talking about a new resource, and the title was for families, but it really is for families, educators, and providers. Um, and just to give you a little backstory about how this resource came to be, I will share those two pictures on the left are my two amazing kiddos who both have a diagnosis of NDPAE, which is under that FASD umbrella. And when I first got, when we first received that diagnosis, I struggled a lot. As even though I am an educator, I have an education background, doctorate in early childhood education. I did not know anything about FASD. And I thought I knew a lot about parenting until parenting these kiddos. And then I was completely humbled in that process. And so I feel like my journey was really haphazard because I just kind of got online to find everything that I could. And it was frustrating because things were in all different places and I was spending hours online Googling, what is this? How do I parent this? How do I help my kids in school with this? How do I find a provider that understands what this is? And so as the years went on and I found Form Families Forward and got a job here, this sort of became a mission for us to create something that helped families navigate this diagnosis. Maybe shaving off some of that time, maybe creating that community a little bit sooner in that journey so that it didn't feel so lonely and challenging. In 2023, Form Families Forward is an affiliate of FASD United. And so we attended Impact Week in DC in 2023. And at that time, we realized there were a couple other folks from Virginia who were in the room. Some of them were parents, other caregivers. And we got together for lunch and said, what's going on in Virginia? Why do we not have enough resources for this? And thus started a little group that we called FASD Virginia Community. We reached out to other folks we knew, invited anybody that we came across in Virginia to join this community to help us sort of figure out how we were going to elevate this issue in the state and make sure that there were more resources available for caregivers. And we were joined by folks from the University of Virginia Children's Hospital. We were connected with them. They are also an affiliate of FASD United. So we worked with Ali Sturgill and Stephanie McNerney. They presented in week 2 on diagnosis. We got some people from the Center for Family Involvement. I think Lisa Ricard might be on the call right now, and she is one of the family navigators. And she joined us in our efforts, and we had caregivers from across the state join us throughout different parts of this process. They were people raising small kids and young adults because the needs do not go away. It just changes what the supports need change. And so we had a wide variety of perspectives at the table. We met about monthly in this FASD Virginia community. And it was decided one of the first steps we really need to take is to create a website. If I were a parent, what would I need? I would need a space that I could go to in Virginia that everything was there so that I did not need to spend hours researching on my own. So we ended up getting a fantastically generous grant from the Community Foundation for Northern Virginia, and we're very grateful to them for funding this project. And we decided to use that money towards creating this FASD Virginia web hub. And our goals, we sat down, and the goals in creating this were to move Virginia forward in understanding and supporting those with an FASD, and that's something we're still working on. We wanted to create a one-stop shop. We wanted to save families time by having all this information in one place. And a place that could connect them, because there are lots of great national resources and lots of resources in other states, but we wanted all of that to be in one spot. We wanted to help identify local resources for families across the state of Virginia. So for me specifically in this county of Virginia, where can I get help? Who knows what this is? And we wanted to bring together families, educators, and healthcare providers, all of those people who are supporting those within FASD. So while family was really our first priority, we also wanted to make sure, hey, this is a place as a family member that I can send my kid's teacher. And there's resources up here for educators. I can, maybe I found a great therapist who is a good personality fit, but doesn't know much about FASD, but I want them to learn more. I need to be able to send them to this space as well. And be a space to link people to those additional learning communities and opportunities that might be outside of the state. So we do want to say right off the bat that FASD Virginia does not offer direct services. So we are really a grassroots group that put together this hub, this resource hub, and we're going to be maintaining it. But the services do not come directly from us. Some of those services you can get from Form Families Forward, and we're sort of connected with this. And there are other organizations that you can connect with, but really this is just a space for people to get all of that information in one place. All right, so here it is. This was a definite labor of love. FASDvirginia.org is the website. We have put that out on our socials, and hopefully some of you have had a chance to look at it. I'm going to go ahead and open that website now because I think the best thing for us to do is to kind of walk through that and see and make sure everybody kind of understands what's available on this site, what's still being worked on, and then we can take some discussion questions at the end. So there's two ways to navigate the site. Sorry, I'm going to move your beautiful faces to the other side so I can navigate here. You've got a menu across the top here. These are all linked to the different pages. So you can find out what is FASD, who we are, what is FASD Virginia, some of that backstory that I shared earlier, diagnosis, there's training opportunities, there's resources, and there's searching for a provider. So you can navigate that across the top. You can also navigate to that further down here. So as you scroll through, you'll see some of those same links here to what is FASD, about diagnosis. If you're newly diagnosed, getting you to some resources early on. If you want to find a healthcare provider, explore training opportunities. We do have this scrolling, these resources for families and self-advocates. We highlighted two of them here that were some recent resources that we thought would be good things just to plop up there, but this is going to be rotating. So those highlighted resources for families and self-advocates will change periodically. But you can get to all those resources by clicking above on the resources link. And then we also have resources for educators and for healthcare providers. If you click from down here, it will automatically filter just for educators or just for healthcare providers. Okay, so that is our homepage. I do want to go to what is FASD. Because this sort of gives the definition, but what some of those common experiences might be through the lifespan. But then at the bottom, we also have a drop down of some frequently asked questions. So if you need sort of a quick, how is it diagnosed? What are signs and symptoms? What age can they be diagnosed, right? All of those quick FAQs are down here at the bottom. And a lot of them will link you back to things like the diagnosis page or the resources page for additional information. Who we are is a bit of our backstory, tells probably a shorter version of the story that I shared earlier in this session. And again, highlights that we do not provide direct services. We are grassroots, and this is just an emerging virtual network to connect individuals with FASD, their caregivers and service providers to improve the services that they can receive. What I do want to point out at the bottom here, this is a work in progress. You're going to see when we get to the providers and the resources that there's probably a bunch of stuff still missing. Part of that is we are experts in Northern Virginia. and not necessarily across the state. And so we want this to have information from across the state, but we need people reaching out to us who might be in Roanoke, who might be in the Virginia Beach area, the Tidewater area, who are aware of specific resources that need to be added. So if there are things that you see missing, if you need to contact us about something that would be helpful to have on the site, these are the folks that you can contact. So this is really a collaboration between 3 organizations and a bunch of caregivers. So we will reach out to those caregivers for assistance as well. But this is just the most direct way to get in touch with those of us who will be sort of overseeing this site. I mentioned Lisa Ricard. She's at the Center for Family Involvement. She's the regional network coordinator for Southwest Virginia. So she is a great resource. She's a family navigator down there. Kelly and I are on here, and the website for UVA. We don't have a direct link to call anybody. The nurse practitioners that we work with are extremely swamped. So get with us, but know that they are part of this process as well. And they've done a lot of help with diagnosis issues. So that's who you can reach out to regarding the website. The diagnosis page, actually, Stephanie and Allie put this together, the ones who did our second webinar. So they have designed all of this and put all the language in here, going by age, what it looks like. This is a misunderstood and underdiagnosed disability. So we recognize that. And so hopefully over time, we might be able to change some of that language in here. I do want to point out the additional trainings, and we certainly have more to add here, but these are some of the things that I have found useful as a caregiver that we have run into in our work with FASD United and other organizations. But they are not just for families, but there are things here from providers as well. I do want to highlight the FASD Collaborative. This will link you to their on-demand access to recorded webinars. So there's more things there. Proof Alliance. This is great if you are a healthcare provider. They are doing following an ECHO model, and they have this Safest Choice National Learning Collaborative. It's a program between Boston Medical Center and Proof Alliance, helping clinics address FASD in prenatal and pediatric care settings. So if you are a healthcare provider or you know one, this is a great place to send them for some additional training. Facets, the Center for Neurodiversity. This was based on Diane Malbin's model. And it's very brain-based. It is focused very much on fetal alcohol spectrum disorder, but they are sort of widening that to not just be FASD, but other neurodiversities where there's some brain-based differences. They have some great training opportunities, particularly if you are a mental health provider, a social worker, a teacher. This would be a really great model, a brain first sort of model to creating supports and accommodations. We do have FASD United down here, and this brain-based informed mental health community is a new work group that has been put together under FASD United, and they have a new website. I will say that this is going to change. I'm not part of the work group, and we've gotten some feedback about this website, but it's a great place for mental health providers because it's all about a pathway to understanding brain-based informed mental health approaches, which is what's really needed in the FASD community. And so people can kind of join in along wherever they are in that path. So this is still under construction. You're welcome to go to that site and provide some more feedback. I think they're still taking feedback on that site, and that will be revamped. But these are just some connecting you with other groups that are doing some great training opportunities. All right, the meat of this really is the resources and the provider list, right? In our resources here, you can see we just have 53 resources here. A lot of these we pulled over from our FFF directory that were flagged for FASD things. So if you've been on that directory, some of these will look very familiar to you. In this filter, this search filter, you can put in any word you want. So if you want some resources that are going to help you with school, you can put in school, make sure you then click search resources. It does not automatically populate. So please, once your word is in there, you need to refresh with the search resources. And you'll see that there are 12 resources that reference school. School pops up in here somewhere. And so that kind of helps narrow your search. You'll see that some of them are documents. So this All About Me template, if you click on that, it will download a template for you to use. And this is a great template for giving to teachers at the start of the school year to help them understand your child and their strengths, and then some of their challenges related to that. There's also some instructions and a sample completed All About Me that you can see. Some of these resources are webinar recordings. These are the ones that we have delivered, and it gives you a little description. You can and presentation slides, all of those things, and any other resources that went along with it. Another way that you can search is by audience, because we wanted to make sure that people felt represented in here. Whoops. So if you click on audience, we do have them flagged for caregiver or self-advocate, for educator, and for healthcare provider. So resources that are going to help most in those areas. A lot of them will overlap. So there might be stuff in educator that are also in caregiver, self-advocate. So there is some overlap there. All right, so that is our resource page. And then finally, we have search for a provider. I do want to point up at the top here that we recognize that it's not always easy to find a provider, either a pediatrician, an occupational therapist, a psychiatrist, a psychologist that is already FASD informed. That is one of the challenges that we face as caregivers. And so sometimes this find the provider might appear that there's sort of a desert in your area. So what we have also done is develop this document with questions that you can ask providers to determine if they might be a good fit. So if you click on this Word document, you will get a PDF that you are able to print out and either have with you as you make phone calls to folks, bring with you to a meeting. And we have just highlighted a couple of questions that might get at their willingness to work with a client who has a disability that maybe they don't know much about, right? So asking if they've had clients in the past who have been diagnosed. Can they talk about the developmental, behavioral, cognitive, and physical impacts of prenatal alcohol exposure? What do they know about it? What formal training have they received? From whom? What training have they received on trauma and from whom? And so this can really give you an idea. And even most importantly, this final question, are you open to collaborating with other specialists? Of course, lots of people are going to say yes, but you might even talk about what are some other collaborative opportunities you've been in when you've dealt with a client who had some challenges that you needed additional information on. But are you willing to learn about FASD? So don't be afraid to ask those tough questions. And the other thing we talked about a lot as a group is don't be afraid to sort of break up with a provider who's not meeting your needs. That's a hard thing to do because we feel like there aren't many anyway. And so we have found someone and we're just going to keep on rolling. But oftentimes, especially if it's a really poor fit and if there is a lot of resistance to understanding the FASD brain and how it works, it can actually be more damaging to our kiddos than to have somebody that does understand. There's also a little note here. If you're a provider reading this and don't have answers to some of these questions, go to those training opportunities. And we do hope that if you're a caregiver or a self-advocate on here and you're struggling with finding providers, please send them to this site as well. This site is for them to also get that assistance so that they can grow in their understanding of this developmental disability. Okay, so that is some questions that you can take. We also have here, if you come across providers that are FASD informed and you want them added to the list, reach out to us. This is a real quick way. If you click on here, this will open up my email and you can send that to me and we can make sure that they get added. We do need to say that we do not endorse particular people on here. We vet as much as we can, and we take the word of folks who have had experiences with them. But really that is up to you as a caregiver to sort of do your due diligence and ask the hard questions and find out the support. So there's a couple of different ways that you can search for a provider. You can enter your zip code. This can be frustrating. I'm going to put my zip code in here. And remember, you have to hit search for providers. It will not automatically populate. And when I search for providers in the 22643 area code, I get no one, because the way this search is set up, and until we have more funding and more understanding, we can expand this zip code search to an area. But right now it's just searches in that direct zip code. So if you know that you live in a rural area, and you're pretty sure there's not going to be a lot there, I would leave that blank, and that will broaden your search. Because even though I am living in 22643, I can certainly go to 22186 if I need to, right? Or I can I can certainly go to something in Prince William County or Fairfax County. And it would be a little bit of a haul, but I am used to that living out in the country. Another way to search is for specialties. The specialties that are populated here are ones that have already been flagged. So if you don't see a specialty up here, it's because we don't have someone that is flagged as being in that specialty area. We can certainly add them as long as there is someone that we can add with it. But perhaps I'm looking specifically for occupational therapist. I can click on that. Again, you have to refresh with search providers. And right now I've got 2 providers available for OT that I know have experience working with folks with FASD. I know this is not a lot right now, but again, we are growing this. You can also search by insurance types. We have not really fleshed this out yet. So hopefully at some point we'll be able to, some of these could be really tricky, but we'll be able to have things up here for Medicaid. You can also search for specific provider's name if you would like. You can reset this so that it goes back to normal, to ground zero there, and then start to search again. So that is your provider list. Kelly, is there anything that I have forgotten to point out about the website?
No, and I'm just actually putting in, as you've made very clear, this is a work in progress, and we are thrilled to have 25 of you all here tonight who may indeed have, you may be a provider, and or you may know of providers that are indeed FASD informed, or at least have worked well for your family, and are, willing to learn and discuss and collaborate with other providers. So if you have any of those in your back pocket, please let us know. Stacia is a contact on that. Have them contact us, and we would be glad to make sure that we have their listing exactly correct, because we want to make this as robust as possible. And as I think one of Stacia's examples showed, not everybody is in Virginia, but are somewhat reachable from Virginia. So I think that's also important to recognize that we may have to go beyond the borders of Virginia at this moment. But if you have somebody great, know somebody great, that's close enough, let us know, because we would like to include them for sure. Nicole is asking if we have contact with Children's Hospitals of King's Daughters in Norfolk.
Yes, I would believe that they are already in here. We have them under diagnostic center, I believe. So let me search that up. Yes,
There it
Children's
is. Yep.
Hospital of the King's Daughter Development. And I will say, because I did not go further with this, if you click on more information, it pulls up a page dedicated just to that provider so that you can get their address, their phone number, and you can click directly into their website if you need to find more information out about them. So, and then once you're done looking at a provider, you can click here back to that provider list, and that can get you back there. Is there another question, Kelly? Okay. Awesome. Got it.
Stacia, I am going to go ahead and stop unless you have some other words of wisdom that would need to live on forever. I'm going to stop at the recording so that we can have more open discussion.